Hello, everyone. My name is Ignacio, and I'm part of the group focused on eating disorders. Today, I will talk about bulimia nervosa and its criteria according to the DSM-5. Bulimia is described as being a diagnosis that is found far more common among females than it is males. However, the DSM-5 also mentioned that this could be due to lack of represented samples among males. Bulimia is more commonly found between adolescence and young adulthood. There is no current diagnostic test for bulimia, but there are some laboratory abnormalities that may show that may be shown through testing, such as fluid and electrolyte abnormalities, as well as low gastric acid due to vomiting. However, these are not always 100% accurate. They're not always reliable, since similar test results may come from a cause such as food poisoning or dehydration. The DSM-5 mentions 5 criterion samples for bulimia labeled A through E. However, there are 3 essential features of bulimia nervosa. Criterion A, which is described as recurrent episodes of binge eating. An episode of binge eating is characterized by 1. Eating in a discrete period of time, such as a 2 hour long period, an amount of food that is definitely larger than what most individuals would eat in that similar period of time under similar circumstances. This means that the individual is eating an excessive amount of food, and does not necessarily have to take place in one location. For example, going to a restaurant or somewhere else and consuming a family meal, and then continuing snacking through the entire 2 hour period, or going out to a restaurant and consuming a family meal and then going to a different restaurant and then consuming another large meal. 2, a sense of lack of control of overeating during the episode, such as feeling that one cannot stop eating or has no control about how much one is eating. This can also be described as the inability to stop eating, even when it gets to the point where one feels completely full. Criterion B is described as recurrent and appropriate compensatory behaviors in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics, or other medication, fasting, or excessive exercise. Criterion B may occur after criterion A in order to try and get rid of the guilt that comes from the excessive eating. The most common behavior is vomiting, since it provides immediate relief to the discomfort that comes after the binge eating. In other cases, the behavior may be vice versa, and the goal may be to binge eat in order to reach the goal of making oneself vomit. Criterion D is described as self-evaluation is unduly influenced by body shape and weight. This behavior can be seen in individuals who become very concerned about the way their body looks and how much they weigh. And in this scenario, the goal is to use vomiting, binge eating, and then regurgitating again as an effort to achieve weight loss and maintain body shape and maintain body weight. Okay, so to qualify for the diagnosis, individual must meet criterion C, which is binge eating, and inappropriate compensatory behaviors must occur on average at least once per week for 3 months. Criterion E is the disturbance does not occur exclusively during episodes of anorexia nervosa. An individual is considered to be in partial remission after full criteria for bulimia nervosa were previously met. Some, but not all, of the criteria must have been met for a sustained period of time. In full remission, once considered after full criteria for bulimia nervosa were previously met. None of the criteria have been met for a sustained period of time. The level of severity is based on the frequency of inappropriate compensatory behaviors. Again, that means behaviors such as binge eating and then vomiting, as well as laxatives, etc. So a mild case is an average of 1 to 3 episodes of inappropriate behaviors per week. So someone that engages in binge eating and vomiting 1 to 3 times per week. A moderate level is on average 4 to 7 episodes per week. And then a more severe case is someone involved in an average of 8 to 13 episodes of inappropriate behaviors per week. And then on the other spectrum of extreme is having 14 or more episodes of inappropriate behaviors, vomiting, using laxatives, diuretics, binge eating, etc. Per week. Okay, thank you.